I'm a first-year undergraduate at Stanford University, and I am planning on majoring in chemistry in the biological pathway. I was born and raised all my life in Oakland, California, and I've been a patient at Asian Health Services for as long as I can remember. My parents, brother, and grandma are also all patients, and AHS has been there to support us through a lot of different times. When my grandma, she had some medical complications, the doctors were talking about hospice care, and my mom was like, what is hospice? She would call me and ask me what is hospice? And I didn't know how to tell her that it's end-of-life care. Asian Health Services has provided so much, not only medical advice, but I think emotional support in the language that they're most comfortable with so that they can explain these life-changing circumstances. And I think that's almost as crucial as the medical advice itself.
I think the legacy of Asian Health Services is always thinking beyond just clinical services. I think it continues today with regards to how we look at the violence that many of our communities are fearful of and that they may have experienced. And Asian Health Services has never said, we don't pay attention to that. Asian Health Services always said that is also part of our mission and part of our responsibility to illuminate what those issues are.
Do you know somebody that has been affected by violence or feeling upset or stressed after their experience? Even if they are not physically hurt, they may have emotional issues that they want to address.
Our strength is knowing our community, and our contribution was to be able to collaborate with other communities that were facing many of the same problems. Our support and our collaboration and partnership with African American community, which from our very early days, our early federal funding was made possible because of West Oakland Health Council, which was critical for us being able to get substantial base funding. We're stronger if we work together, not only in our voice, but we'll be stronger in being richly informed about what we're experiencing and about effective strategies that we can pursue that would address the upstream and the policy issues that could hopefully make a difference.
As the chair of the health committee, I've watched the Asian Health Services, and when you look at the growth that has taken place since Asian Health Services has been in existence, the ability to come and add dental services there, to be able to link up even more with primary care and specialty care services, and to be able to provide them in the various languages, you have to applaud all of the fight and the hard work and the ability to find the funding to sustain those kinds of programs. And so when I look at that growth in such a short time, 50 years, which is still short time, I have to really say that they're pretty close to the top. Being able to diversify those services and to have them in a number of community-based settings that make it accessible to Asian Pacific Islanders and others who receive the services there.
Asian Health Services looks at the health of their community in a holistic way. Certainly it includes getting vaccines and getting health care and behavioral health, but it includes other things too, like national federal policies impact the health of their communities. If the public charge rule is changed and people who access food, safety net services, or healthcare or housing safety net services aren't allowed to lawfully reside in our country, that's a problem for the communities that they care about and they love. Asian Health Services says we're going to look more broadly, more comprehensively at all of the factors that can impact the health of our community and address those. No one does it alone. Asian Health Services has done a lot in partnership and in coalition, and please always consider me and the California Department of Justice as part of your coalition. I'm always on team Asian Health Services.
Hi, Kelly. Homa. Right over here. Okay. So I'm just going to go ahead and take a look at your eyes first and then your ears, okay? So I'm going to look inside your ears. Let me take a look. I first learned about Asian Health Services when Manette Tang, she was a community health specialist at the youth program. And she actually came to my high school and did a reproductive health class. And she basically said, if you want to join any of the youth programs that we have, you can always swing by. And then I came by and I never left. And that was when I was 14 years old. And so I'm 36 now, so that's been about 22 years now. Pachi. I think the people that decide to stay and work here, they're really for the community and they're really for the mission. What I love specifically about primary care at AHS is that I'm seeing my patients, I see their babies as well. I see their babies kind of grow up. I see their grandparents. I see their dad's side of the family. I see their mom's side of the family. I know everything about their family, what they do, where they live, who lives in the house. And I think being able to develop that relationship, this long-lasting relationship, it just doesn't get any better than that.
Asian Health Services is so unique an organization in that we provide excellent services because of incredible staff, and we have a culture of excellence. We have leaders that could go anyplace else. They could go anyplace else, they can make a lot more money and have impact at the same time. I mean, carry out their values in a broader arena. So many of our staff could do that, and yet they choose to stay here.
It's so incredible what Asian Health Services has grown into. Today, AHS is the largest employer in Oakland Chinatown, and they employ more than 500 staff. It's a real economic engine because every day, Asian Health Services brings in hundreds of employees and patients into the community. And after their medical appointments, they eat at local restaurants, they shop at the grocery stores, they visit the library, they go to the rec center. They just become part of the vital beating heart of Oakland Chinatown as a living neighborhood.
I would say my experience at AHS really reminds me of like a second home. All the physicians that I've talked to, the mental health physicians, the primary care physicians, so many people have been really good role models for us. And that's propelled me to want to pursue a career in healthcare, especially in primary care.
My oldest brother in the 70s asked me, "What are you doing at Asian Health Services? Nobody does that kind of work anymore." And I just felt that was rather insulting. I thought, no, maybe I'm not at some high-powered medical center. I don't have a big title, but I'm doing important work and work that I really embrace and want to devote my life to. I feel fortunate. I was able to come to this country to be able to go to medical school. And I should do something with that helps other people. We have a lot of challenges that face us, but I am very, very confident that the young leadership is going to confront those challenges and be creative and involve the staff in the community, because this is what we deserve and what we need. Quality, not only healthcare, but a quality life and existence for all people.